Okay, well, I guess our project is a large grant, so there are a number of components to it. But one of the things we really want to do is show how important art can be, both improving the quality of life of the person living with dementia, but also in helping those around them understand the condition and make life easier for the people with dementia and the communities in which they live. So we're using art as a catalyst for change.
And how do you deliver that in the community?
Okay. Well, we're at a number of stages. In the first instance, one of the things we found out as we were developing this study is that the actual evidence base around the effectiveness or the value of art, particularly with people with dementia, is quite limited. So we really wanted to improve on that. So what we've done is developed a study where we're using a whole range of different methods. It's quite experimental, a little bit different, really challenging some of the assumptions out there around how we can conduct this kind of research. So we're using numbers, narratives, visuals, you name it, we've got it in this study actually. And one of the first things we did was to look at the art programme itself and what we actually want to do with or for the people with dementia with their involvement. And so we looked at some of the existing work because there's loads of interest in this kind of topic at the moment in the country. Dementia is really, really a hot topic of debate. So we looked at some of the existing work that had been done. And there's one or two models that we thought were perhaps better than others. But again, the research around them hadn't really been done to the level that it should have. So what we've done is tried to take the best of those existing programmes, worked with our own research artists. We've developed a draft guidance booklet. We haven't really got a name for it at the moment, but we're calling it Foundations for Excellent Practice, which our artists have been put into. And they're actually going to use that now in their practice in our research. So ultimately at the end we'll refine it and we'll have a freely available guide, booklet, whatever we decide to call it at the end, so that anybody who wants to do this kind of work has got something, a point of reference with which to work from. As part of practice development for artists and people who would want to work in this kind of services scope, that's one of the main objectives there as well.
So is this being delivered through, through something like the National Health Service or?
Yeah, we've got 3 different research areas which are on here. So up in the northeast, we're working in care homes. So we've got our community arts partners, an organisation called Equal Arts, who's working alongside Newcastle University colleagues from Newcastle University in a range of care homes up there. In North Wales, we're working with Dementia County Council Community Arts. We're actually going to be delivering all our research in a community setting. So we're working with people with dementia who are still living at home. And in Derbyshire, we're working in an NHS assessment unit, so it's very much a closed shop. So we've had all the challenges of the ethics approvals and getting things in place.
So I can understand how using art with people who are suffering from dementia can work. And the thing that I'm interested to hear is, how do the carers access this kind of information? Are they seeing what you're doing with the sufferer merely as a point of understanding that this might help the sufferer, or are they gaining an absolute benefit themselves as well from being involved in that process?
We think perhaps both things will happen. What we initially are looking at with our study is how it might change people's attitudes. So even with the best will in the world, people can still have some quite biased assumptions about the levels of capabilities of somebody with dementia. So we're looking at how the carers, the care staff, how through the duration of our study, how their attitudes at the start might change by the end. And we're using systematic ways of capturing that and measuring that. And at the end of all this, when we've collected all this data, we're doing this over a 12-month period, we'll have data from about 300 people. we're then going to use the results and the output that's being used to go and do some really innovative work, kind of like some of the stuff you see here, getting out there, going to festivals, just popping up in different situations and circumstances with our challenge. Let's talk about dementia stand, and just really engaging with the public and asking them their opinions and what they think about the capabilities of somebody with dementia. And
so the way that you spoke, this is going on right now.
We've just started, actually.
Okay, and when is it? It's a 12-month project, yes?
No, it's 38 months. So we don't.
38.
Yeah. We're not actually going to finish until August 2016. So we're at the point now where we've worked with our artists. We've got our foundations for excellent practice. We've started working in the care homes and in the community setting. So far we've got 22 people with dementia taking part. We've got 20 to 23 carers and staff taking part. So we're just in our early stages now. And we're about to hopefully get started in Derbyshire later this week or early next week. So.
And forgive me, I'm one of those people that knows very little about dementia. But is the expectation of the outcome here that what you're doing is going to make life easier for the sufferer, or is it actually something that's going to retard the progression of the disease?
I think the whole interest, the prevention side of things is very interesting. That's not something that we are able to address with our study. To look at the preventive aspects, we would need what you call a longitudinal design, where you track the same people over a period of time, perhaps ideally before cognitive impairment started. So just trying to design a study like that is actually quite complicated. But what we do know, or what we're hoping, and what we've seen from the anecdotal results so far in the sessions, is that what we're doing is really helping people's mood. And for example, in one of the sessions last week, somebody said, "Oh, I feel alive again." So if you look at how improving mood can be a kind of a mediating pathway towards feeling better overall with your life, then what we're doing is really, really valuable. We're not saying we're going to cure. We know there's no cure at the moment. And while we're waiting for a cure, it's really important that people are able to take part, enjoy life, and just get on and do what they want to do.
I can imagine that in this kind of scenario, just getting somebody to say, "I feel alive again," must be a tremendous benefit for you and the team.
Yeah, it's fantastic. And I guess that was just something that pops up in one of the sessions, and it wasn't necessarily, as researchers, we're kind of trying to capture all these different outcomes. So that was just an added bonus, I guess. So we're all feeling very optimistic at the moment about how it's going. So, yeah.
Good. And so if anybody wants to find out more about what you're doing, how do they do that?
Okay. Well, we just launched our new website, which is one of the reasons we're here. So we have a new website which has been administered. It's been set up and organised by one of our community partners, Age Watch. So they're in charge of the website. So everything about the project is on there, and there's a mail list. If anybody's interested in finding out more, they can just drop an email or give us a call, and we'll get back to them.
Great, Jill. Thank you very much for your time.